So this is kind of our post-show on the show, as you guys have, those of you who've been here before have done our post-show with us before. The health disparities is something that we sort of touched on there in that last segment. We've done a whole show on it before. Are there barriers to what we're talking about to certain groups in our community? And what do we mean when we say health disparities?
We touched off mentioning one, which is that Connect Care closed, and that was a huge asset to the community that has been, I think, a real disaster. I think maybe you can speak a little bit more to this. Those patients don't have a lot of places to go, and they turn up into emergency rooms. For those that can end up getting care, and I think for those that don't, they end up with chronic, complex diseases that we pay for down the line when they end up on Medicare or Medicaid.
Yeah, it's terrible. I mean, that was a really valuable asset in the community where folks who otherwise didn't have any place else to go could go there, could see the same provider, for instance, over time for several months or even a couple of years. There are folks who volunteered, there are physicians and nurse practitioners who volunteered their time there and really took great care of people for the resources that they had, and so that was a big loss.
So what's taking its place?
Well, right now, nothing. So folks are kind of spreading out. They wander into our emergency rooms or others around town. They try to show up at regional health clinics and see if they can get in there or try to find some providers. But that's group, interestingly enough, as we've kind of talked about, the population will sign up for insurance, will sign up for this or that. Those folks have the hardest time even knowing what their options are, what's available to them, how to sign up. They don't necessarily have computers per se or other things, and so it's very difficult. And so it's a real outreach that needs to happen to them to try to bring them into the tent.
Once they get on the computer and they try to sign up for a program, it's not so easy to be able to compare the plans, particularly for the provider networks, to find something that's in their area. Because if you're in the city and you want to have access to Barnes Hospital, or you want to have access to, BJC or SLU, not all the plans have those. I mean, some people are hearing, well, all I need to do is get a Coventry plan. Coventry has BJC, the BJC system in it, but that's the Coventry PPO network. There are Coventry CareLink network plans that are also on the marketplace, and those are Mercy and SSM only. So if you pick a Coventry CareLink plan, and they're not bad plans and they're less expensive, but they are a more limited network. So if you do choose one of those plans, you need to be aware that you're not having access to the full network. And then the Anthem plans, which everybody has been sort of talking about and aware of, do not have the BJC network as well, but they do have St. Louis University Hospital.
So one of the great points that's bringing up is the whole issue of literacy. And I think one of the challenges we're going to see as we face moving forward, I think a lot of the changes that are really good are people getting coverage. But we're now going to uncover, as we peel the onion, how people actually navigate the system and can they do a very good job at it. So we're talking about people that may never have had insurance before, may never have had it for a long time, that might be challenge in terms of not having much education, or they might have English as a second language or something like that. And can they navigate some of these complex issues that we just mentioned? Do they know what a premium is, a deductible, a copay, a co-insurance? Can they know what networks mean? Do they know? And so they may be used to going to the emergency room or Connect Care, so they have to learn a whole new way of getting health care.
Not even those people. I work with very bright, well-educated people who have a hard time understanding co-insurance and premiums and deductibles. And
I feel better.
So.
Yeah, right. Because I want to be able to label myself
alone.
as positively as possible. That's good.
Enrollment is only the first step in all of this. And after that, it's a matter of paying your premium, keeping the policy over a length of time, and then understanding how that policy gains you access to care. And if you can't kind of figure out all three of those things, then there's going to be barriers for you in the system.
And then using it.
Correct, in using it, and using your health care to get health care and hopefully have a much better health outcome. And if you're unable to do those things just because you have a lack of understanding around the instruction, the language you have on your plans and you get from the providers is unclear, there's going to be major issues in getting care and having a positive health outcome.
I want to back up for just a second, because am I getting the wrong picture here that we're talking about with Connect Care closing, that you have a level of people who are getting more coverage, or more people who are getting covered, and that at the same time people are kind of getting left out. It's like getting better on one end and fraying at the other end. Is that it?
Part of the problem is we're in Missouri here, to be honest with you, and we made some decisions, as our legislature did, that we are now seeing some of the ramifications of it, to be honest. That's part of the story. So not expanding Medicaid has created a big hole in the safety net. And we would have brought in $1.5 to $2 billion this year, which would have really helped Connect Care and much of the safety net. That's not the whole story. As Doug pointed out earlier, there have been cuts to Medicare payments. There have been readmission penalties that like BJC has been paying. And there's the sequester cuts. You know, people have to remember when we passed budget cuts, we passed a lot of that to Medicare too. So you put all that together, you're going to be challenged in any one of the states, but you're going to be more challenged in a state that didn't expand Medicaid.
And we haven't even touched on mental health. You're talking about disparities. We haven't even started discussing that yet, and that's a huge issue. So these same people who are uninsured and with Connect Care closing and not even having access to that type of emergency care or urgent care, again, a lot of those had mental disease. So again, we're talking about a very fragile part of our population that they're not getting services because of this budget cut.
I feel like I do have to speak for some of the folks we've had on the show here who've said, why would we put more money into a system that they see as broken, that system being Medicaid? Why would we expand something that's not working?
Well, I mean, I actually challenge the point that Medicaid's not working. There's a lot of good evidence out there that Medicaid, if you compare the Medicaid system, as challenged as it is, to being uninsured, there's no doubt all the data suggests that Medicaid is much better than being uninsured. It's not as good as Medicaid, Medicaid's much better than being uninsured. It's not as good as Medicare or private insurance. We have a sort of a 4-tier system. So I don't think Medicaid is broken. And sure, could we fix it? Could we transform it? Absolutely. There's always reforms that can be made. But the other thing is, remember what we talked about earlier, the dollars that would flow into Medicaid, there are dollars on the other side that are going to be used to pay for this. We now will have less uncompensated care. That's accounted for on the other side. So it's not like this is just adding dollars onto the budget. And the Congressional Budget Office said it was roughly budget neutral.
Yeah, and expanding Medicaid and bringing people into the healthcare tent and reforming Medicaid, or being creative about how we organize Medicaid, maybe how we interact as a healthcare community around Medicaid, those are not mutually exclusive things. We can expand the tent, bring people in, and work hard on what are the best ways really to care for people. What are innovative models we can try at different facilities to try to make Medicaid more efficient or less expensive, that kind of thing. We need to bring people into the tent first and get them into the system where they can actually get the help that they need. And the healthcare community in general already is really changing right now. It's a big time where all the big health systems in town and other folks are trying to change how they do business. They're really rethinking their models given the changes in healthcare. And so it's a great time to say, okay, come on in and let's figure out how to take care of you. We can do that.
How many people are in the tent right now? What's our percentage of uninsured in Missouri?
It's roughly about 15%, 14 to 15%.
Okay, so for the other 85%, what does this law, how does this have an impact on the lives of that other 85%?
Well, if they use the exchange, they have one big thing that they've got to make sure they take care of, which is the conversation we had earlier tonight about some plans in which healthcare systems are in or not, or individual physicians may be in or not. If those part of those 85% are going to get, they have insurance now, but they're going to get new insurance under the exchange, one of the first things they need to do is they need to call their doctor, if they have one, or there are several doctors if they see different folks, and ask what they're participating in. I'm really worried that in the first quarter of 2014, we're going to see the law of unintended consequences show up, where people went on, they looked at the plans, they said, oh, this looks like a good plan for me or for my family. They signed up for that, and with one click of a mouse, they just wiped out every physician they see, and they can't see them now for the next year.
I'm sorry, Ed, you've been so quiet. I meant to talk to you sooner. So represent for Twitter here for us real quick.
We talked about it. Mental health was brought up. Where does that fit in this? And I think, generally we heard a lot of tweets tonight about this is very confusing. And just maneuvering, especially for people that had never had it before. And so, looking for 2014, how are they going to maneuver in this new field, this new opportunity for them? So that's really something that really came out a lot.
You kind of go in the system, you need someone to stay with you when you get in there.
And even for the 85% that have had it before, I mean, they're really confused
Yes.
too. There are a lot of people who come to us saying things like, well, I want Obamacare, so I have to go to the website. Well, maybe they don't even qualify for the subsidy. They don't have to go to the website. They could go to a broker or agent. They could go to ehealthinsurance.com, a web broker. I mean, there's other resources.
I'm not cutting.